Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echo, vascular, general, high-risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Today, our guest is Lynn Flamm. Lynn is a registered diagnostic medical sonographer with 33 years of experience, but the majority of that has been dedicated exclusively to obstetrics and gynecology ultrasound. She began her educational journey at Southern Illinois University in Carbondale, Illinois, where she earned an associate's degree in radiologic technology and allied health specialties. She went on to specialize in ultrasound at Forest Park Community College in St. Louis, Missouri. Yay! And later completed her Bachelor of Science in Healthcare Management at Southern Illinois University, Carbondale. Throughout her career, Lynn has pursued additional certifications to strengthen her experience and advance her professional path. With a passion for teaching and mentorship, she is committed to sharing her extensive knowledge of OB-GYN ultrasound with students, sonographers, and healthcare providers. To further the mission, Lynn developed Sonotechnics Academy, a comprehensive OB-GYN ultrasound teaching app available on the web and mobile platforms. She is also the host of the Seasoned Sonographer podcast, where we share insights, case discussions, and conversations designed to support the next generation of sonographers and providers. Please help me welcome Lynn Flamm. Lynn, thank you for joining us today on this podcast. I'm excited to talk today about changes over the years in OB-GYN ultrasound. And Lynn has a plethora of experience, 33 years in experience in ultrasound, and her specialty is OB-GYN. And we're going to talk about all the changes. So welcome, Lynn.
Thank you. Thank you for having me.
Yeah, you're welcome. So I guess first, just tell us a little bit about yourself and why you chose ultrasound for an occupation and why you chose OB-GYN for your specialty.
Well, I was first inspired to do ultrasound when I was in high school. My friend had a mother who was a nurse, and she said, one of you girls has got to go into radiology. And so I didn't know what else I was going to do. So that sounded pretty good to me. And so I did. And then when I went through the radiology program at SIU Carbondale, I then realized I wanted to specialize. I had a great clinical instructor as I was going through those different specialties, CT and MRI, and, the mammo center and things like that. I decided that ultrasound was something that I wanted to do. I found it challenging. I found it to be more tech dependent, not so much, button pressing, if you will. And I know there's more to MRI and CT than that, but it was more tech dependent and challenging. And then when I graduated from St. Louis Community College at Forest Park in St. Louis, Missouri.
Oh, I didn't know
yeah.
that. I did too.
Yeah. Oh, you did?
I did. Yes.
Oh my God.
And Mary Baker.
And Mary Jane Baker. That's right. And, I just went to a conference in Seattle, and there were 3 attendees there that had graduated from that program.
Awesome.
That I'm such a small world. But anyhow, that's a great program, and I give all the accolades to them and how Beth and Mary Jane taught us, and I attribute my success in my career to them and that program. But
Absolutely.
anyhow, so then I there was no full-time jobs available, so I took on 3 part-time jobs, and then the first one that turned full-time was in an OB-GYN office. And so I took that full-time position and away we went.
That's awesome.
Yeah.
That's amazing. And you stayed in it all these years.
Yes, I've stayed in it. I have found it to be super rewarding, and I feel like that in OBGYN, I could continue to make an impact on mothers and their babies, and hopefully change outcomes and provide great patient care.
Absolutely. Let's try to go back in time because you've got 33. I've got a little over 25. I stopped counting after 20. I think after 20, you just keep going, right? So
We just keep going.
you can go back into your earlier career and get a snapshot of that. How would you explain that for us?
Well, when I look back to when I was in ultrasound school, I mean, so much has changed. And even my first job, there was only 2D grayscale imaging. And I remember when I was doing one of my clinicals, it was a big deal that the vaginal probe got Doppler capabilities. And Doppler has come so far, the color has come so far. And, it used to be a lot of on the job training.
Yeah.
So, ultrasound programs, training has changed. A lot of nurses would on the job train and then take their board exams. Yeah, so a lot has changed for sure. I think that also the AIUM guidelines and standards now are more prevalent. I don't remember AIUM guidelines when we were in school, but
Not a whole lot.
anyhow,
It wasn't
I
discussed
remember
a
learning.
lot.
Yeah, it wasn't. If they were there, I don't remember that terminology. So I don't know that the guidelines were firm and the standards were set. I just duplicated what was being taught
Right.
to me.
So tell us about the equipment and the training. We talked about most of it being online or on the job training, but there were advances in equipment and even in the training. Um, so how the probes have changed and different things of that nature. Can you tell us a little bit more about that?
So the machines have changed. The machines have improved. I mean, it used to just be a snowstorm trying to pick your way through images. So the qualities that the machines produce, the high frequency probes with increased detail, the Doppler capabilities, all those things have improved drastically. But along with that goes higher expectations and more responsibility for the sonographer because we see more and we can be held accountable for more. But that improves patient care, and we have an opportunity to use that technology to improve patient care and to provide better outcomes for patients.
Yeah, and there's been new improvements. You mentioned earlier some things in your outline as far as like 3D and 4D and different ways to measure fluids and cervical length has become a topic of discussion throughout the years and different things of that nature as well. So,
Right.
yeah, and they're all important, but like you said, it comes with that is more information that now we are responsible for to obtain,
Right.
to evaluate successfully and to report it, you know. So
Right.
next let's talk about there's a lot of confusion, I think, between routine second trimester ultrasound anatomy scans and detailed or level 2 scans. Can you explain the difference and what the requirements are for each of those?
Yeah, so the second trimester routine anatomy scan, the 76805, is what's typically done in a normal OB-GYN office or at a hospital when your doctor orders, the anatomy screen. It's focused on the basic structures, the fetal biometry, brain, heart, spine, kidneys, stomach, bladder, and also looking at the placenta and fluid. But the detailed level 2 anatomy screen that's usually done at a maternal fetal medicine office, which is the code 76811, it just dives deeper into the detail of all the anatomy and adds, an increased detection for abnormalities by adding extra heart views, like the not only the outflow tracks that are done in the second trimester anatomy scan, but it adds the arch views, the aortic arch, the ductal arch, the SVC and IVC view, the bicaval view. It looks closer at the palate, the maxilla, the mandible, the tongue. Of course, all the regular anatomy. Oh, the spine. The spine, not only in sagittal and transverse, but they look at it coronally too. And I'm just trying to remember some of these things from the conference I just went to. And then now there's the accreta spectrum.
Yes.
There, and a big risk factor for the placenta accreta spectrum is a previous C-section scar. And there
Right.
was a whole talk on that was amazing. But two, the cervical length measurement is standard for both these anatomy screens, but there is a special technique in doing it. As you know, when you put the probe in the vagina, you wait, you get the os of the cervix, the internal os and the external os, and see that nice white line, and then you pull back a little bit so that you're not falsely elongating that cervix, and then you want that cervix to be at least 2.5 centimeters or greater. So that is routine for both of those types of scans, and that should be being done in the OB-GYN offices. What else is new? A lot of times the umbilical artery Dopplers and the MCA Dopplers are done. We do the umbilical artery Dopplers in our OB-GYN office, but not the MCA Doppler. So that's a little bit of difference there. And how deep do you want to dive, discovering fetal anemia and, placental insufficiency?
Yeah, and I think I have described it too, since I work in high risk OB too, as in the 76805 scan, a lot of times we're just documenting that baby has two legs, two arms, hands, and feet. And in the 76811, we need to know the condition of those arms, those legs, the angle of the foot coming off the tib and fib. And, we look at the hand opening and closing and any extra digits that may be, on the hand or foot. Like, we're looking at the condition of the structures as well as are they there, right?
Right.
And
In greater detail, right.
and a lot greater detail. So, yeah, I think there's a big difference between the two. And I think it's interesting because I even work for a maternal fetal medicine doctor, and
Mhm.
we were in a conversation and I said, well, there's a big difference between just the 76805 and the 76811. And she goes, no, there's not. I'm like, well, maybe not here, but I think high risk doctors don't realize there's a difference, right? That people do practice the 76805 differently than the 76811, right?
Right.
So,
And even if it's done in a regular OB-GYN office, it's not documented
correct.
like that because you can't code for it anyway and bill for it anyway. It has to be a maternal fetal medicine office. So those things might be looked at on that level, but not coded and billed
And
accordingly.
labels. I've had people come to maternal fetal medicine from an OB office, and some of the differences is not as much documentation. They don't have to label their imaging in a private office versus a high risk clinic.
Mhm.
Um, so, and there's not as much documentation, right?
Yeah.
So those are some of the things I've heard too over the years.
Yeah, especially in the offices that might not have a radiologist reading the scans. And a
Right.
lot of
It's
times in those
just
private OB-GYN offices, there isn't one. Now, I have worked and continue to work with a radiologist, even from our private OB-GYN office. And so, I mean, right. The documentation doesn't have to be there if you've got nobody checking in on you, really.
right. And quite honestly, I did have a conversation recently. I in the present job that I'm doing right now, I'm in a room doing my work alongside residents, fellows, physicians, right? Because I'm in a learning institution at this point in time. And one of them is a chief and getting ready to graduate and looking for jobs. And so she turned to me, she goes, "Do you mind if I ask a question?" And I'm like, "Sure, you can ask me whatever. I might not have the answer, but I'll try my hardest." And she said she's applying for jobs where they want her to read the ultrasound in the private office. And she goes, "I don't feel qualified to do that because we've had no ultrasound training for that." And I'm
Yeah.
like, yeah, that would be a little
That sets
scary,
everyone up for
right?
litigation. Yeah.
So I think there's this need for awareness again from like your perspective and your training, mine, that there needs to be more training for physicians, for residents, for fellows, for ultrasound techs, to be able to know what the differences are and be able to read and see the pictures and know, right? And she goes, "Well, I can tell what things are, but like I don't practice reading them." And I'm like,
Yeah.
because that's just not part of their curriculum, you know?
Right.
And
Right.
so she was a
I
little,
feel like the AIUM has provided an avenue for that as far as like the accreditation that they offer, even these private OB-GYN offices, if they, submit their images, do all the required things, they can become an AIUM accredited office. And then there is physicians or a physician in that private practice that's responsible
right.
then for the reading and follow up on those ultrasound images and scans.
Yeah, but just another opportunity for us to kind of maybe step up and offer some more training, you know?
Oh, right. Yeah. There's always room for more, for
Yeah.
sure.
Right.
Mhm.
So then tell us, we've reflected about a lot of the technology part of our job, but tell us over the last 33 years of your experience, what's been the most rewarding part of your work for you?
The most rewarding part over the last 33 years has been actually making a difference and making an impact in the mother and the fetus and even GYN patients. When you detect abnormalities and they get referred to gyn-onc, I feel like, you know, I've made a difference. And doing the best that I can do every day to detect any abnormalities, to give that baby the best chance it can have, to detect any GYN abnormalities that might alter someone's life. Like I feel like that's the biggest thing that I do is hopefully create an impact that will produce good patient outcomes.
Absolutely. I think that's the most rewarding part for me, is to know
Yeah.
that
Oh,
our work matters, right?
right, it does, and, it's to us, it's exciting to find an ectopic pregnancy because it's like finding a needle in a haystack and you're
Right.
victorious,
Right.
and, it affects the patient, it affects their life, and it literally can save their life, and
Right.
so when you can save a life or, predict preterm labor and delivery by doing a proper vaginal length, or cervix length, And, when you can determine, oligohydramnios and placental insufficiency in a fetal growth restricted baby, you are making an impact. And I just think that, that is so rewarding.
Absolutely. What are some of the challenges that you faced in adapting to the new protocols and technology, and how did you overcome those kind of things?
Oh, it's always a challenge for old dogs to learn new tricks. It's
But we do
always
do
challenging.
it. We do.
And I know, and even when you're not an old dog, I mean, you just can't be intimidated because technology is going on down the road, and you better be ready. You have to prepare yourself. And, so some of the challenges, you just have to overcome them, whatever the challenge may be. Just, drive hard and get through them. And because that's the new way of doing it. So you better get on board and learn it. And really, perseverance in your profession, and stay up with the times, and lean forward, and, make yourself better in your profession.
Yeah, you have to challenge yourself, right? And I think one of the things you have to do is to be really honest with yourself, right? Like that's kind of hard to do sometimes of,
Yeah.
okay, this is where my strong
Right.
points are. This is where I have room for improvement and address it, right? Like don't wait for your supervisor to address it with you. Like take it on yourself, right?
Right.
And
Right.
really kind of go at it. If you could give one piece of advice to students or new sonographers or even seasoned sonographers, what would it be?
It seems so basic, right? But treat your patients how you would want to be treated. Treat your patients how you would want your mother or your sister to be treated, if they're having a GYN or an OB problem. And I really love the Maya Angelou quote. People will forget what you said, and people will forget what you did, but they won't forget how you made them feel. And I try to live by that every day, even outside of work. I mean, just be compassionate, be patient. It's not your job to judge, to judge their situation or whatever. Take care of the patient and love people.
Yeah,
Be the kind, be the kind person that they don't see very often. Maybe be the light in their day, and make a difference by just smiling and making eye contact.
absolutely. Well, I applaud you because after 33 years, you've continued to challenge yourself and to grow. And you've created this beautiful app that I would love for you to talk about and tell us what you've done to give back to our community and to further your development of yourself. So tell us about that, please.
So I have developed the Sonotechnics Academy app. It is an OB-GYN ultrasound teaching app. It is mobile. It is web. It contains AIUM guidelines, interactive checklists. The Alara principle has a little module and section in there because first and foremost, patient safety, fetal safety. And it has OB modules and all the trimesters, voiceover teachings over videos, over images, instruction on how to obtain the image, what we're looking for, how to optimize the image. It has then quizzes over each of those modules. It also has GYN quizzes over each of those modules. And then, where you select the correct answer. And if it's right, it's green. If it's wrong, it's red, and gives the explanation at the bottom. And then it also has 500 flashcards. So if you're studying for your OBGYN boards, you can go through the flashcards when you're walking on your treadmill, when you're walking through the airport. It's just a see the question, tap, and then swipe for the answer, tap for the next question, and swipe for the answer. It's just question, answer, question, answer. And then Yeah, so it's got a section for resources. Some of the obvious resources are in there, like a link to ARDMS, AIUM, STMS, JDMS. But then I have also linked my podcast called The Seasoned Sonographer, and I've linked it in the educational app because it is a teaching podcast. And in it, I talk about what the exam is, how we obtain the images, how we can make them better. And then I bring on providers, certified nurse midwives, nurse practitioners, physicians, and we talk about what they do with the information that they get from us as sonographers. And from that ultrasound report, what happens in the exam room? How does that affect the clinical management, the patient, delivery timing, things like that? How does that affect referrals? So that has been so fun to just talk to people. And I know you could say the same thing
I
because
can. I
yeah,
love it.
yeah,
Yes.
it seems
Love getting
you
to
really
know
enjoy
other people and what they bring to our world of ultrasound. It's
it.
been a
Yes.
real gift.
Yes, it has been an amazing ride. And so you can find my app at sonotechnicsacademy.com, and you can subscribe to my podcast on Apple Podcasts, Spotify, and YouTube. So yeah, so it's been quite a ride, and I've gotten some great feedback from it so far. And the app targets students, ultrasound students, and practicing sonographers, providers, healthcare providers that want to know more. Sometimes the the sonographers and the hospitals don't get enough OB-GYN patients to be proficient and confident in what they're seeing and doing. And so this would be a great resource for hospital sonographers and anybody, maybe they're studying for their OB-GYN boards, but starting at the ultrasound program end gets those students more well prepared for the OB-GYN um, unit that they do and their clinical setting.
Awesome. Absolutely. It's a beautiful app. If
Thank you.
you guys have not been there, she's put a ton of work into it. And I can't say enough good things about it. So Sonotechnics Academy is the name of it. Please look it up. Please get involved and interact with it. I think it would definitely give you a leg up and take you to the next level in your training and in your care given to patients. And so please interact with it. So thank you again so much for coming on the podcast and sharing your expertise and thanks for being in it for so long and recreating something to give back to us, right? I
Right.
think that's the key to sticking with it for so long is that you kind of have to recreate something within yourself to give to others
Right.
the longer you're in. And so hats off to the fellow Forest Park Community College graduate. I love that
Yay.
we both came from the same and
Yeah,
uh,
that's so cool.
had the same instructors.
So you did your clinicals in the same places that I did.
I
Yeah.
did. I did. And
Yeah.
so my first jobs were in Washington University, right, in St. Louis. And
Yeah.
so it's amazing group of people, even as I'm sitting here at an STMS conference, meeting other sonographers in other areas of the country or the United States.
Yeah.
And it's just a great group of people to be a part of. We're all wanting to make an impact and make a difference. And we have that opportunity, right? To do that in our job.
Yes.
I have other girlfriends or friends who do other jobs like IT, or, I have a daughter who's an architect, and I'm thinking, I'm sure the architect feels, and the IT, I'm sure they feel it's a contribution to society, right? But they don't see the immediate effect like we do. We
Right.
see it within a few months or you know, of the
Yeah.
patient. And so I'm grateful that we're in a job that we can see that we make an impact immediately
Right.
on different
Right.
and help educate people and give them hope. The other
Right.
day when a physician was telling a patient her baby was small, to us, that's an everyday thing, right? We
Yeah.
see small
Right.
babies all the time. But to a first time mom or to somebody who's had a previous pregnancy with no problems, and now all of a sudden, why is my baby small? And as women, I think we turn inward and blame ourselves, right? And as a sonographer, now I see that as opportunity to just say, hey, look, we do this all the time. And we're really good at managing this to get really good results.
Right.
So we don't worry for you because we know we get good results. But we don't worry for you because we have these other standards in place to check in
Right.
on baby, right? We know how to check in on baby. We know when things start to go south and what they look like. And so we're going to check in on baby often, right? And
Right. Early detection, right? Early
right,
detection is key.
right, in order to get that good result. And so I think our other part of our job, not only technically, but is to give them hope. Like we do this
Right.
all the time. You're in good hands. We have good results most of the time, right? And this is how we have good results by surveillance, right? So I
Right.
think we're there to offer reassurance. Hey, this is not in your control, right? This is something outside of what you could or could not do. And
Right.
um, giving the good results, right?
Right.
And the
Right.
hope that things will be just fine, right?
And I always say, do the best you can do. And, telling the students, do the best you can do. And if there's something that you can't get or that's suboptimal, for crying out loud, say it. Bring them back and look again because it's somebody's baby. It's somebody's outcome.
Right,
And we do that stuff every day, but we can't just be checking off boxes and pushing them on through. If you
right,
can't get good heart views, bring them back.
right,
And, make sure that we're getting that quality scan that you're talking about and
right,
giving good results and giving accurate preliminary reports. And don't be afraid to say, I can't see it. I can't see it well enough that it's diagnostic.
right. Absolutely. Honesty is the key, right? Honesty
Right.
is the key. Thank you, Lynn. Thank you again for all your contributions. And thank you for coming and sharing your story on our podcast today.
Thank you for having me, Deb. It's been fun and you have a great conference.
Thank you so much.